costs for mental health services are on the rise in Stanislaus County. Darlene Thomas with the National Alliance on Mental Illness in Modesto is one of the people who answers them.
They have a loved one living with a mental health condition, and many times it's alcohol and or drug abuse on top of it.
The problem, experts say, is that there aren't enough professionals in the field to respond to all of them quickly.
I have 2 teenagers and 1 child that took a nosedive in his own mental health during the pandemic. And he spent 7 weeks on a wait list to see somebody that by the time it rolled around, he didn't want to see anybody anymore.
But the county is trying a new approach to address a lack of mental health clinicians. 50 caseworkers and outreach workers are set to begin training to become lay mental health counselors.
So a lay counselor is someone who doesn't have a mental health degree or a license, yet they do have the skills and they've received additional training and they're providing mental health care.
It involves 65 hours of specialized training, as shown here in a video of a training conducted out in Oakland. Lessons include motivational interviewing, cognitive behavioral therapy strategies, supportive counseling, and deep listening. Each applicant is carefully selected based on their skills and experience, but having these unlicensed workers in the field is raising questions for some.
If, they can get training in there, to help these case managers and social workers deal with their clients, better meet their needs, to understand them more. I think that would be good. As far as doing therapy, that's, I think, a whole nother ballgame.
Morrison explains these lay counselors would not take the place of any licensed therapists or clinicians or step in for things like diagnosing or crisis intervention. Instead, they would be working under the supervision of licensed clinicians to provide listening and support for any clients who may be struggling.
I think Stanislaus County and all of the people who send people through the Lay Counselor Academy are really looking at those wait lists, those 3-month, 4-month, 5-month wait lists, and trying to get those people who are waiting with nothing in to see someone who can spend time with them and help them.
But it doesn't stop there. Lay counselors are also being trained to provide a wide range of care and resources for clients. In Modesto, Josie Hart, KCRA 3 News.
And training for this program is set to begin in July.